Welcome back to Boson Buzz. I'm Monty Molecule. Our bodies are in constant, quiet conversation with themselves. Trillions of cells go about their business, and when something goes wrong, like the first rogue cell of a cancer or a protein misfolding in the brain, they send out signals. For most of medical history, we've been terrible at listening for these whispers. By the time we detect a disease with a scan or a biopsy, it's often because it's begun to shout, having grown or spread. The battle is already uphill. But what if we had a listening post so sensitive it could hear the very first murmur of trouble, years before any symptoms appear? What if a single teaspoon of blood could become a window into the deepest, earliest secrets of our health? This is the story of a new detective in medicine, part ultra-sensitive machine, part artificial intelligence. This is the Bloodhound Machine. The challenge of early detection is like finding a single specific person in a bustling metropolis, using only a fuzzy old photograph, and only after they've started causing a commotion. Today's tests look for things that are relatively easy to spot but appear late. A tumor big enough to see on a scan or a high level of a common protein that only rises when a disease is already established. By then, the window for the simplest, most effective treatment may have closed. The dream has been to find the earliest, most specific traces, the equivalent of finding that person's unique fingerprint they left on a doorknob weeks ago, or a single strand of their hair on a city sidewalk, even if they've since washed their hands and moved on. This dream is becoming reality through a technology called liquid biopsy. The idea is profound in its simplicity. Instead of cutting out a piece of tissue to examine, an invasive and sometimes risky procedure, we look for the microscopic clues that all cells, healthy and diseased, naturally shed into the bloodstream. It's forensic science for the living body. When a tumor grows, even when it's just a tiny cluster of cells, it sheds tiny fragments of its unique, mutated DNA into the blood like genetic confetti. When brain cells begin to misfold proteins in diseases like Alzheimer's, they release traces of those abnormal shapes. The incredible challenge is that these clues are astonishingly rare, a few abnormal DNA strands among billions of normal ones, a handful of misfolded proteins in an ocean of healthy ones. Finding them has been like trying to hear a pin drop in the middle of a hurricane. This is where the machine becomes a bloodhound, with a nose of unimaginable sensitivity. The hunt begins with ultra-sensitive filtration and capture. A small vial of blood is processed through microfluidic chips, tiny labyrinth-like channels etched into silicon. These chips use precise forces to sort the blood's contents not just by size, but by electrical charge and even surface markers. They act like molecular fishing nets, designed to catch only the exotic, rare clues: the circulating tumor DNA, ctDNA, the tiny lipid bubbles called exosomes that cancer cells emit like messages in bottles, or the unique, misfolded protein fragments. This step separates the potential signals from the overwhelming noise of normal blood cells and proteins. But catching a suspect molecule is useless if you can't interrogate it. The next step is to read its secrets. For DNA clues, this is done by next-generation sequencing. Each captured fragment of genetic material is copied millions of times and then read letter by powerful machines. It's an exhaustive process that deciphers the entire genetic story contained in that drop of blood. For protein clues, ultra-sensitive assays use glowing antibodies that latch onto only the specific misshapen forms, making them light up against the dark background of normal proteins. This stage generates a colossal, raw data file, a digital dossier on every strange molecule found. This is where the artificial intelligence, the brilliant, tireless brain of the bloodhound, takes over. The raw genetic and protein data is a chaotic, billion-piece puzzle. The AI has been trained on mountains of this data from hundreds of thousands of known patients, some healthy, some with early disease, some with advanced illness. It has learned the patterns. It knows what the faint, early whisper of pancreatic cancer looks like in the swirl of genetic noise. It recognizes the subtle signature of inflammatory proteins that hint at a future heart problem. The AI doesn't get tired or distracted. It combs through the new patient's data, comparing it to these hidden patterns with superhuman speed and accuracy. It isn't looking for one giant, obvious red flag. It's detecting a constellation of dozens of tiny, almost imperceptible anomalies. A slightly higher frequency of this mutation, a rare combination of those protein fragments, that together form a unique signature of very early disease. It can even perform molecular triangulation, using clues to suggest where in the body the trouble might be brewing, all from a blood sample. The impact of this is a paradigm shift in medicine, from reactive to relentlessly proactive. For cancer, it could mean annual screening that catches tumors when they are just a few hundred cells, tiny clusters easily treated, potentially with a simple injection or minimally invasive surgery, transforming many cancers from feared killers into manageable, chronic conditions caught in their crib. For neurodegenerative diseases like Alzheimer's or Parkinson's, it could provide a warning a decade or more before memory loss or tremors begin. allowing for preventative therapies to be tested and applied when they might actually stop the disease process in its tracks, preserving a lifetime of memories and mobility. It turns medicine from a discipline of waiting for you to get sick into one of preserving your health with pinpoint precision. Of course, this powerful tool must be used with great care and wisdom. A positive signal from the Bloodhound Machine is a whisper to be investigated with more tests, not a final diagnosis, but it gives doctors and patients a profound head start, the gift of time and choice. The ultimate vision is a future where a routine checkup includes a simple liquid biopsy read by an AI bloodhound. Your doctor gets a report not just on your cholesterol and blood sugar, but on your body's earliest molecular conversations, a wellness forecast. This allows for interventions that are gentle, early, and overwhelmingly effective. A change in lifestyle, a targeted drug, or closer monitoring. We are learning to listen to the faintest signals of our own biology, to hear disease in its first breath, and answer with a cure before it ever finds its voice. The Bloodhound Machine doesn't just diagnose, it gives us the ultimate gift in medicine, the chance to prevent. From late-stage battles to early silent intercepts, that's the transformative promise of the Bloodhound Machine. It represents a new era of hyper-vigilant, compassionate medicine, where we no longer wait for disease to declare itself, but seek it out in its hiding places with impossible sensitivity. It's a future where our greatest medical victories are the terrible diseases we never have to fully fight. If the idea of catching illness in its faintest whisper fills you with hope, please help Boson Buzz continue the hunt for knowledge. Give this video a like and subscribe for more stories of medical marvels. I'm Monty Molecule. Until next time, have a safe and curious week.